Oshkosh Area School District regular meeting on Wednesday, August 13th, 2014. Are we in compliance with open meetings laws?
Yes, we are.
Can you please call the roll?
Dito?
Here.
Eliason?
Here.
Garner?
Here.
Herzog?
Here.
Limburger?
Here.
Saganek?
Here.
Weekoff? We have a quorum.
At this time, let's do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. This time, looks like we have board and administrative reports. There is no board president report. Superintendent, Mac, do you have a...
Yes. We have a very brief superintendent's good news report for this evening, August 13th. First of all, the Video Game Design Academy was held this summer. The 26 Oshkosh students enrolled in Video Game Design Academy held at Horace Mann Middle School in Neenah, sponsored by the Fox Valley Writing Project. The academy included a total of some 45 students entering grades 5th grade through 9th grade throughout the Fox Valley, and they participated in a number of activities in creative writing. The camp accumulated in a celebration where parents were invited to play the child's game, and ironically most of the parents made the same faces playing the game as their children did. So should have been there. Another summer activity, the summer school ceramic mural class, comprised of middle school students from around the city, spent 5 weeks in their summer creating beautiful murals. Students were encouraged to design and complete a community-based piece of artwork that will be displayed at local businesses or organizations at the end of the summer course. Students worked with clay tiles that they manipulated, designed, and painted. Students learned the processes of ceramic mural work, public works of art, and how individuals can be enriched by their communities, and conversely, how the community can be enriched by their young members. Students involved in the making of the murals are listed on the as well, and we're thankful to teachers Mary Yang and Renee Schumacher. Permanent homes for the murals have yet to be determined. I would imagine that some organization or school could put in a request to have be the permanent home for those murals. Next, for a 2.5-day period, the Oshkosh Area School District administrators spent in their administrative academy gearing up for the new school year. A fun part of the academy was, over the past few years, has been also making that a kickoff event for benefiting United Way. This year, administrators voted for 6 of their peers who would earn a spot in the dunk tank. Due to tie totals, there were 8. As was expressed clearly a number of times, one tie, all tie, all are in. And those who took the big splash included Alyssa Hoffman, Vice Principal at Oshkosh North, Tony Bird, Vice Principal at Oshkosh North, Dr. Dave Gunlock, Deputy Superintendent, Linda Perone, Director of Special Education, Jackie Schleicher, Principal of Oshkosh North. So we really did get 100% of the administrative team out of North. Tim Dolish, Vice Principal at Oshkosh West High School, Jill Prascarella, Principal at Carl Traeger Middle School, and Jay Jones, Principal of Perry Tipler Middle School. Over $1,000 was raised through the varying activities, bribes, opportunities to throw, and also those who bought insurance to avoid being put in the dunk tank.
And the United Way thanks all of you.
It's a nice $1,000 kickoff for the events that will be coming. Cooking up ratatouille for school lunches, farm-to-school style. Today, the Winnebago County farm-to-school and food service staff from Amaro, Winneconne, and Oshkosh School District teamed up to prepare and freeze 1,250 pounds of ratatouille, okay. Eggplant, peppers, onions, garlic, and fresh herbs from 3 local farms. Some of the basil even came from Emmeline Cook Elementary School's garden project. Students will have the opportunity to eat the
Oh, boy.
ratatouille sauces in various dishes like pasta, wraps, and pizza. Fun school events will be held to promote the sauce, like showing clips of movies and sending home colorful flyers and information on the game. Volunteers hand out samples of the dish while inspiring children to try it. The project is made possible through the United States Department of Agriculture Farm to School grant and the Transform Wisconsin Grant Award and Rethink a Healthy Living Coalition of the Winnebago County Health Department. I'm sure there'll be great interest in sampling that. And lastly, the superintendent's calendar for the last several weeks. We should note the fact that we had well over 200 individuals attending Ed Camp today, of which a fair number were our own teachers and administrators, but primarily we also had lots of guests from around Wisconsin attending as well, and was being hosted through the courtesy of the University of Wisconsin Oshkosh at their fine education facility. So with that, completes the report.
Are there any other reports from committee chairs?
Education Committee met on August 4th at 12:15. There was not a public forum. The entire meeting was pretty much focused on the reading, math, and benchmark data, which Julie Mosier did a very in-depth job of reporting that out to us and really giving us the details of each school and how the students are progressing in reading. Starting this fall, all grade levels 4K through 11 will have reading assessments done during the school year, and supports are being put in place so that doesn't disrupt too much instructional time. Information about students not reading at benchmark was reported, and as well as a plan being put in place at each school to address those deficits for the kiddos. And for the teachers who are trying to also increase those scores through teaching in other innovative ways. Since that was most of the meeting, yeah, that was pretty much it. It was looking at each school, looking at where the gaps are, the deficits are, and the plans that'll be put in place to address that. The next meeting will be the second Thursday of each month at 9. So the next one, we don't really have a date, but it's the second Thursday. So whatever that date is, coming quickly.
Other reports? Anybody else have any other reports? Not seeing any. Moving on to workshops. Looks like the first one is the near-site clinic. McNulty and Sonora.
Good evening. I'd like to introduce Al Yeager, and Al is probably a familiar face to you, but Al is the Senior Vice President and Senior Benefits Consultant with AFG, and AFG has been very, very helpful relative to our progress that we've made with a near-site clinic. And you'll notice that we do use the term near-site clinic versus on-site clinic, because at first when we started with this project, we were looking at an on-site clinic, which would mean the clinic would be on one of our sites, of course, and we have worked from that perspective, but we are going to a near-site clinic, and the near-site clinic is going to be, of course, near to the school district, to the county, to the city. And back that up some. I'm sorry. That's all right. If you look at this slide, you'll notice it's presented to the Oshkosh Area School District, the City of Oshkosh, and the Winnebago County. Could you go to the process? And one more slide. So, okay, right there. To back this up, you'll notice that we started in the fall of 2003, but actually we started in the spring of 2013 when Sue and I basically we're in consulting and in contact with Mike Collard, who is the HR person with the county. And the reason we were in contact with Mike was because prior to coming to Winnebago, he was the HR person in Sheboygan County, and over there he had worked through a very similar process, and they did have a clinic that was part of the county, part of the city, and part of the school district. And that's how that's where we actually, that was our starting point. Then in fall of 2003, basically we started working with John Fitzpatrick, Mike Collard, Sue and I, and we were in AFG, and we were basically learning about near-site, on-site clinics and as much information as we could find out. December of 13, we made a request for information to see what vendors would be interested in possibly doing a on-site or near-site clinic with us. And as you can see, in February of 14, we interviewed 4 viable finalists: Affinity, Aurora, Intera, and ThetaCare. After the interviews, we narrowed it down to basically Intera and ThetaCare, and that was a very extensive process. In April of 14, then we started to determine we wanted to make some on-site visitations. So we went to the Sheboygan Area School District Clinic and they have Intera over there as their vendor, and we also went to ThetaCare over in Appleton, and then HealthStat came out, and we decided that we were going to include them in our study, and so we did an RFI for HealthStat. We conducted an interview, and we did a site visit with HealthStat in West Bend, and it was very, very. The West Bend clinic is an on-site clinic right in their central office. Very nice setup. But here was my biggest takeaway from West Bend, was basically that no, their health insurance is self-funded. We're not self-funded. We're fully insured. They're self-funded. They've had the clinic up and running for a couple of years, and going into this fall, their health insurance increase was 0%. And we've been going at pretty much double digits in the trend for quite a while now. So I mean, to even think about the possibility of getting to something like that someday is just so encouraging. Possibly, now that's hopefully on the horizon, but we'll see where it all goes. Then after that, we decided to do an official formal request for proposal, and we did that with Intera, ThetaCare, and HealthStat, and here we are in August, even though it says July, and we've sorted everything out. We've decided on a vendor, and that's the purpose of tonight, is to bring you up to speed with exactly where we're at, because hopefully on August 27th we're going to come back with a resolution to move this forward, and then to possibly and hopefully implement as of January 1 of 15 and have a clinic open to our employees and their dependents and their spouses. And then Sue, would you go to the agenda, please? Thank you. So the agenda for tonight is I just went through the process, and we're going to talk about why clinics may make sense for an organization. A shared clinic. Why would we want to have a shared clinic with the city and the county? Why would we want to collaborate? Who is the recommended partner? And so who's going to be our vendor? What are the projected costs? What's a case study? Some next steps, and any questions you may have. All right. And I think.
Sound to me.
I think so, Al.
Sure.
Thank you. So, we have talked in the past on many occasions about wellness and why the clinic model, et cetera. And in a summary, we talked about the whole analogy of healthcare in general historically has been reactive. It's more or less been set up at the bottom of the cliff and taking care of individuals once they fall off the cliff. Well, the clinic model is largely a step in the direction of building that fence off around the top of the cliff to prevent people from falling down. It's a win-win for all involved, and that's really what prevention is speaking to here. And in regards to 75% of healthcare costs are directly stem from preventable chronic conditions, and it just lists out like type 2 diabetes, hypertension, obesity. And as we know, when you are dealing with chronic conditions, there are major costs, loss of, from individuals, quality of life, disability, as well as productivity. So these are some of the whys. And thank you. So with that whole thought process of the way the care delivery model has been hardwired to pay for acute care or reactive, the idea is better preventative care, chronic care compliance, and convenience. And one of the other items that's certainly noteworthy is when it comes to care, and if any of you have gone through this with a parent or a loved one or a close friend in general, you will find out real quickly that healthcare can be very difficult to have coordination from provider to provider, specialist, primary care, and it becomes very fragmented. And what that results in is certainly unnecessary costs, delays, frustration, and eventually even loss of control of certain confidence from the patient. As far as approaches and options in general with healthcare in the past, you'll see, the standard ones, right? Additional cost sharing, plan design changes, more co-pays, deductibles, less benefits. And those clearly are items that come on the backs of the individuals. And what the whole idea with the clinic model and strategy is actually trying to enhance from a benefit standpoint, from a prevention standpoint, from a health standpoint, and the whole idea is, just coordination and convenience. Growing demand from the workplace clinics, and certainly those are large reasons for it. Cost to the staffs, cost to the employer, improvement in health, access, improvement in access, and it becomes an opportunity to, frankly, improve in attracting and retaining staff members. Now, when doing a survey, and this was done by Towers Watson, reasons that they're going the route of a on-site, near-site health center, happier staff members, happier, healthier, ultimately more productive, lower cost, medical cost, and certainly a center to better integrate healthcare. Noted again some of the other items, improve access. Can also be items that can expand beyond what might first come to mind, such as occupational or safety, which is certainly more on the workers' comp side of the equation. So as far as different objectives, different options, certainly can expand when going through the RFI process, going through the interview process with the various models, whether it be acute care that can be accessed, certainly a wellness focus, preventative care, lifestyle coaching that's available, disease management, and again, a lot of wellness focus above and beyond. And when you're thinking of some of the advantages, there's certainly short-term and there's long-term. The short-term, which we've gone through, is frankly, it's a lower cost option that can be available for some of the items for both the staff members and the district. And as you go through the list, as far as the fixed cost fee, and when individuals are using it, it's less expensive to them. It's less expensive to everyone involved. It's a new relationship that helps navigate through some of the confusion. But frankly, the long term is probably the bigger deal. And those are things like helping, when it becomes a trusted medical advisor, somebody that's readily available, convenient, low cost, low to no cost type option, coaching starts becoming readily involved. And those are the scenarios when coaching becomes involved, that the trusted medical advisor and the staff member or the patient now all of a sudden, you start seeing some of the conditions and situations are avoided. Those are some of the long-term savings opportunities. So that's when we go
That's me?
into.
I'm going to talk just a little bit about why we're sharing this experience with the city and the county. As the number of dependents, we're probably large enough to run a clinic on our own. But we looked at the Sheboygan model, which is the city, county, and the school district, and they've been very successful. Waukesha is in the process of opening one with the city, county, and the school district. And I think just being able to have all those additional resources together will allow our clinic to be more flexible. We'll be able to offer maybe more services, maybe have longer hours of operation. So I think there's some economies of scale with combining with these two other people. And then you can see here some of the other reasons why we would be willing to share. But basically, it's just so that we have enough people to really justify the services. We looked at several different models. You can do a variety of ways you can run your clinic. You could just have a registered nurse, a nurse practitioner, a physician's assistant, or a doctor, or you can have any combination of these. What we are looking at doing is a physician's assistant or a PA, and mostly because after we saw the West Bend clinic, they have a pharmacy in their clinic. And when they run the numbers as far as return on investment, you get a huge return on investment from having your own pharmacy. And not like, if you just need a one-time drug, it's really not for that. It's for people who are on a maintenance drug. And it gets the person they have to go to the clinic to use the maintenance drug. But then the cost of those drugs that they can get them for through the clinic are much cheaper than what we can get them through in a Walgreens or a Walmart or a local pharmacy. So, and the only one of those, other than a doctor, which makes your model very expensive, is a PA can also dispense prescriptions. So we are looking at the PA model. As Mike said earlier, we chose to go with Intera for a variety of reasons. For one, they are an independent provider. They are not affiliated with any provider. And in Oshkosh here, we have a number of providers. And this way, we are not choosing one provider over another provider. We're going with an independent. From a cost standpoint, Intera provided the best value proposition. And I think also the other thing about Intera is that when they can't meet every need of every person who comes to visit them. So they are going to be referring people out to other physicians, and they will be referring people out to the best option for that person, not necessarily the provider in a certain network. They'll refer to the person that's best for that individual's condition. Sheboygan County City and School District also use Intera and have had really good luck with them. And finally, Intera has a really genuine wellness focus. And I think if our clinic is going to be successful in reducing costs in the long term as well as in the short term, wellness has to be a big component of that.
Sue, how does that work if they're referred to somebody outside that could be in a multiple providers?
Well, one of the first things they will know is they'll check who is in our network. So even though we have a different insurance from the city or for the county, the clinic is going to have access to all that information and who's in the network. So they'll know which providers are in our network. So they'll first look at that.
Okay.
And then they will also have information on the quality of those providers. And then they will refer, if someone doesn't have a preference themselves, like if I'm in the clinic and I don't know where I want to be referred to, they will help that person make that decision based on the quality of the providers that are in our network. Does that kind of answer your question or not really?
So they'll be referred to somebody in the network.
In our yes, our health insurance network, yes.
Yeah, it works pretty all-inclusive, so.
We have United Healthcare network, yes.
But the clinic will have access to who is in our network, and so they would only refer to.
Okay, that's what, okay.
Yes. Yeah, sorry. This slide just shows an estimate of the first year's operating cost. Again, it's just an estimate. And as a school district, when you take a look at the total number of members, employees, spouses, dependents, retirees who are all under our plan, we are really 50% of the three entities. So to begin, we will be bearing 50% of the cost. But this is going to be reviewed on a quarterly basis to see how the system is being utilized. You know, if 50% of the utilization isn't from the school district, we're going to redistribute those percentages. But at least to get kicked off and get started, we're looking at those percentages because those are how the members are broken out. Now, of course, the first two things, the startup and the clinic renovation and improvements, are just one-time costs for the first year. And then the rest of those are just estimates based on Intera's information about the number of dependents. Again, that could go up or down depending upon utilization. And they've recommended a certain staffing level based on our number of members. So those could go up or down depending upon how many staff we initially open the clinic with. Now, GHT is going to give us $500,000 to operate the clinic the first year, and as you can see, our costs are $640,000. The difference will come from our HRA, because if an employee, with our high deductible health plan, when an employee goes to the doctor, that deductible, if they haven't met their deductible, that comes out of the district's funded HRA. So if anyone goes to the clinic, those costs then are not hitting the health insurance and they're not hitting the HRA. So the HRA expenses should go down, and I believe that that'll be enough to fund the difference between the $500,000 that GHT is giving us and these estimated costs. And Al's going to talk about the Sheboygan study.
So just some background information in both the school district in Sheboygan as well as the county. What you'll find is some of the results. The county has been doing it, the clinic model, longer than the district. Meanwhile, from a district standpoint, some of the initial observations, they've had low single digit increases from a healthcare cost since implementing the model, which, as Mike indicated earlier, that would be a breath of fresh air. And as far as some of the noted focuses, as we continue to do health assessments from a biometric standpoint and focus from a clinic standpoint on the compliance and the follow-up, there's an understanding that as we do the health scores each and every year with, in this case, Sheboygan Area School District, there's recognized every point of improvement as from a health assessment equates to 1.8% of medical costs, claim savings, which, as we know, claims are about 95% of our premium costs. So that would, in this case, be about $360,000. Meanwhile, some of the additional noted savings from an employee standpoint when using a clinic, there's 22% from staff member savings. Clinic savings from a primary care is 57% versus a standard, the standard clinic costs. Immunizations, 30%, chiropractic, 33%, which, by the way, that was a surprise, significant surprise as far as the amount of utilization in that example was chiropractic. From a county standpoint, in their case, since 2008, also low single-digit increases. They also plugged in from a chronic condition compliance program, which included some, Sue identified, for example, from a pharmacy standpoint, one of the other benefits that when you start including a pharmacy is the fact that since it's lower cost, compliance improves, which is another piece of, from a compliance opportunity standpoint. But anyway, the county saw a 65% savings in that care versus an employer-sponsored, in this situation when it was done from a coaching and disease management. The employees, 31% savings. The clinic savings for primary care was 48%. Immunizations, 64%. And chiropractic, 35%. So pretty notable results in the county and the city in those examples. Meanwhile, just taking out a specific procedure code that we had noted when looking at a pretty standard office visit from primary, in this case, moderate complexity, counseling, coordination and care, 25-minute office visit, general retail cost about $232. Through the health plan, we would get a discounted rate, roughly $156.90 would be charged to your health plan. The patient cost in that case is $17.43. Meanwhile, comparing that to an on-site cost or a near-site, you're looking at $52. So just one of many examples of just kind of the differentials in the cost. Sue?
Basically, the gist is to have both short-term and long-term savings, both from the employee standpoint and the employer standpoint. You know, in the short run, we save money on office visits, we'll save money on prescriptions. The employee is also going to save money going to the clinic. We haven't made the final decision yet, but I think we're going to make it no cost to the employee to steer people to go there. I mean, right now we have an office visit cost and we have a deductible, and we are considering not having either of those if they go to the clinic. It's recommended by Intera that that's what you have to do to really get steerage to the clinic. And so the employee saves money. And then from a long-term standpoint, just the disease management component and the wellness component of that, we hope to save money in the long term as well.
If you don't mind my adding, I think just an important piece here is understanding that these clinic models, they are under the same rules, guidelines, regulations from a privacy as any other hospital or clinic. So from that standpoint, I think it's just important to reiterate that fact that this isn't something that the district would have or anyone would have any different access and information.
We'll get aggregate data from the clinic so that we can see if it's providing us the return on investment that we hope for, and we'll be able to use that information to decide future staffing of the clinic, but it'll all be aggregate. We will never ever as a district get individual participant information in the clinic.
Is this covered under HIPAA?
Yes, of course. Our next steps is we'll be bringing this back to the August 27th board meeting, asking permission to just go forward. At that point, we won't have a finalized contract with Intera yet, but we will be very close. And we are still working on the interagency agreement between the city and the county and the school district. We're meeting next Tuesday, so we're going to work on that. I don't think we'll have all of that ready for the 27th, but we'll be asking your blessing to at least go forward, and then we'll be bringing those parts back to you as we have them finalized. Intera is working with us to secure a place for the clinic. They've already got several locations. We are looking at someplace close to Highway 41, so it's easy access, because not only in the school district, all our employees work within this little radius, whereas the county, the county employees are scattered all over the county. And also our employees live all over. So if we can make the clinic somewhere that's very easy access, and we're looking at a number of options that are really close to the Highway 41, different interchanges, so that it's easy for our employees to get to. We need to continue to finalize exactly what services that we're going to offer in the clinic. And then October 1st, we hope to start the renovation. We need to start talking about marketing materials and communication with our employees, and then hopefully open January 2nd. Now, that date is a little tentative because the city and the county, we want to bring them with us, but they're having some insurance concerns that they have to work through. We have GHT that's on board with us. They don't have that luxury, but they also are not going to hold us up either. So we may wait a month at the most, but otherwise January or February is our opening date.
And it should be noted that this same type of conversation is taking place with the governing boards for both the county as well as for the city in the 4 to 5 week period at the same time.
So that's our formal presentation. I'll open it up.
I had a couple questions, I guess. The first one is on, what is, you've got this on the summary, what is strategic plan goal G1B?
Is that under the employee part? I can't remember now. I don't have the strategic plan in front of me, but we did add this to the strategic plan under.
Well, that's right, we added it.
But we added it under one of the priorities.
Yes.
It's nothing I have to I can find this out on my own by just visiting the website and stuff. I was just wondering if you had it under employee based or if it was under financial sustainability or under something else within that.
I can't remember where we put it, but we did add it as an action step under our strategic plan.
Okay, now you had on your presentation, you had talked about Sheboygan having $20 million claim budget at 1.8% is $360K. That you say, what is our claim budget? Is it similar? I know we're a similar sized district, but
We're a little
bigger.
smaller. I don't have that number right off the top of my head, but we're similar size. We're a little smaller, so that it might be a little smaller than that, but our claims to premiums have been really high, so.
Right.
Our total premiums are like, help me out a little bit, I think about 20 million, and for about 95% of that. This might be a ballpark number there.
Okay.
For your information, it's goal 1B. It's under goal 1B, the employee section.
Okay, thank you. What is your gut feeling right now with the possibility of the county and the city involvement?
It's very high because
Very
the people, their equivalents to our positions in the county and the city really, really want this to go forward. I think the only thing is they're working on getting their health insurance on board. So I think that's been the only issue. Their leadership is on board, and the people in their equivalent roles to ours are on board. So I believe that'll happen.
Okay, my only other question was tying into that is, all right, if they do not do this, the total startup cost, and this is $1.2 million, will we have to sit there and realize we get the $500,000? But will we have to pick up the remaining amount by ourselves on this then?
The startup cost we would, but then we could always prorate them back a share if they join us later.
Okay.
But then our operating costs would be down because we wouldn't have to hire as many people right off the bat.
Okay.
And I believe AFG represents either the county or the city as well, so it's been helpful to have two of the three entities having the same insurance consulting firm.
Other questions? You guys got questions? Barbara?
Not a question as much as a comment. I'm very impressed with the work that has gone into this. Sitting in on the NTEA and OPEA conversations regarding projected increases in the compensation, and listening to members of those teams talk about the challenge presented in being able to absorb the increased health costs that we've seen in this district and other places have seen over the years. And I think this is a very proactive approach to helping hold those in line that benefit not only those two groups, NTEA and OPEA, but everyone in the system. So to me, it's really win-win. It helps the individual, and I like what you've said about hoping to be able to eliminate some of those costs, the $17.43 and so on. So it benefits the district and it benefits those individuals, hopefully keeping more money in their pockets. And at the same time, hopefully keeping people healthy and productive and happy and glad to be working in this school district, which benefits the students in the long run. So I really appreciate all the work that you've put in on this, and I know you've presented to the board before, and I just want to say thank you for what you've done.
John?
Yeah, thank you. And then you mentioned self-funding earlier. Is this going to make it easier, harder, have no effect? How does this impact potential self-funding down the road?
It certainly would make it easier. And, you know, effectively, we get very, very good claim reports as far as the volume of dollars going in and out compared to premium each month. And at this point, that part doesn't make sense just from the standpoint that for every dollar you're spending in premium, I think it's about $1.20 in claims that have been going out. But to answer your question, the idea here is to make self-funding certainly would be a lot easier, just because when claims go down, that'll make that much more sense.
Thank you.
Other comments? Thank you, guys. When this first brought up last year, I was excited about it. And it's progressive. It's something that needs to happen, and I think that long term, this will be very positive for our district.
Quickly, what kind of response are you getting from the district, from the staff, from the teachers, from the professionals? What kind of?
I sent an email out earlier in the week to all district employees to either stay tuned to this workshop, or I just gave like 5 or 6 bullet points on the clinic, and I didn't get a lot of response, but the response I did get was very positive.
In our communication so far has been fairly limited, and that's been as a result of the 3 entities working together. I mean, we have to somewhat synchronize pieces, and as Stan alluded to earlier, all the elected officials from all 3 entities will be getting this information in a relatively short period of time, and the same thing with all of our employees. But as we progress now, we'll be increasing our communication with our staff, and as Barb said, I from every perspective, it's a win-win. So, I mean, if we can make it convenient, confidential, and less costly for our employees, and ultimately less costly with our premiums and higher productivity and stuff like that. I mean, it's all good stuff. We want to be able to make it happen.
We've discussed it with our benefits. We have a strategic benefits committee. This has been brought before them, and we have brought it to union leadership. Awesome.
And part of what I think is the key phrase that I believe Sue put in the original memo is that participation is voluntary. And that kind of takes the, I think for those who might be fully committed to a certain physician and have a relationship, they know they're not being forced into it, but when they can make an elective choice to go to a clinic that has 0 out-of-pocket expenses and build a long-term, you're planting the seeds of, and especially families with children. I know the frequencies between the ear infections and the sore throats and all of the varying things, and paying office visit copay every time. That creates a big incentive. But the fact that we're not forcing individuals to break their relationship with their existing provider is the first tentative step, and I would hope that as people discover the goodness of wellness of this project, that they will also convince each other that it's better not to spend money outside. The longer one that is harder for people to understand is the fact that in the long term it is beneficial to the school district entirely as well as the individual to take that sharp edge off the ever-increasing health insurance premiums. And that's really clear from what is West Bend and Sheboygan and other places as well.
It's become a very high percentage of districts, especially of your comparable size throughout the state, have moved or are moving in this direction.
Mm-hmm.
And another key component when you talk about the committee, one of the things that we do every year is review an audit for the next 3 to 5 years from a healthcare reform compliance. And it becomes very apparent when dealing with the Cadillac tax threshold, et cetera, that status quo isn't an option. And what this is a way to, in your words or in your example, this isn't displacing primary care, it's augmenting. And the idea is if we can do it in a more efficient, cost-effective way.
Thank you, guys.
Thank you.
Our second workshop is the draft of the Oshkosh Area School District 2014-15 budget. Susan.
While I'm waiting for the next PowerPoint to come up, I just wanted to introduce Jim Fox. He's in the back row there. Put him on the spot. He is the new Buildings and Grounds Director. He was approved at the first board meeting in July and came on board August 4th, so he is in like week 2. You will meet him up close and personal next board meeting when we do the McKinn Street presentation. So, but I just wanted you to be able to put a name with a face. Budget 14-15. I call this our year of transition because we have just a ton of stuff going on. Everything from classroom technology changes to researching what the one-to-one initiative is going to be. If approved tonight, the new compensation model for teachers. We're researching new initiatives from the STEM coordinator to a variety of other things. We have the Lakeside edition. And I'm sure that's just a few of all the things that are going on this year. So it's a year of transition. From a revenue standpoint, our general fund revenues are going up about 3%. And some of the assumptions that I made is that we're declining enrollment by 50 students. We won't know that for sure till the third Friday in September, but I have to do some kind of projection, and based on our past history, I thought that was a good number. But that only generates a $393,000 increase in our budget, which is really nothing. I mean, that doesn't even cover the CPI increase for our employees. So you can see how detrimental it would have been to us if we hadn't passed that referendum. There is a little bit of good news. There's a per pupil categorical aid that started in 13-14 at $75 per pupil. It's actually going up to $150 per pupil in 14-15. So that generates about $728,000 for us. In building the 13-14 budget, now this is just the revenues. The TIF settlement and the sale of green metal were included in revenues. Well, those aren't revenues that are going to be in the 14-15 budget. So now, granted, at the end of this year, that money should still be available because we are not spending that money, so it will go into a reserve fund balance. But when you can look at revenues to revenues, that revenue isn't going to be there. And then there was a loss of about $342,000 in other grants and a variety of other revenues. Now, if a grant is going down, we're obviously going to reduce the corresponding expenditure to that, but there are also just some state aid pockets that are just going down that we have no control over. So this just kind of shows the revenue picture, our 13-14 revenue. Then you add the revenue limit increase, the per pupil aid increase, and then the referendum of $3.9 million. But then you have to subtract those one-time revenues of the green meadow and the TIF. You have to subtract the $342 of other grants and other revenues that are going down, and then the maintenance referendum that we had that expired. But we're also reducing, unfortunately, the maintenance budget by $1.3 million because of that. So then it shows you that our 14-15 revenue is approximately $100,495,000. Now, it's not exact, and the numbers keep changing as we get refined estimates. On an expenditure side, our salaries are going up about $1.9 million, and this includes the 1.46% CPI increase for all the groups. It includes a step and longevity increase for our support staff, and it includes the cost of the transition to the strategic compensation design plan. Then benefit increases are about just shy of $1.8 million, and this is the WRS and FICA on that 1.9 in salaries, and it's also projecting a 10% increase in health insurance, which would be nice if we could get that health insurance under control. I mean, that 10% is $2 million. It includes also an increase in dental, LTD, but then we have those corresponding savings from the life insurance change that we've talked about. This budget does include some new positions and new programs, and I'm not going to go through all of these. I think I'll cover that more in the budget hearing and in the budget document, but about $422,000 in new programs. Some of this is coming from fund balance, because as Stan talked about earlier when we were doing referendum planning, and after that was successful and we started talking about budgets, that some initiatives to start new programs could come out of fund balance because they're kind of one-time expenditures. We're also decreasing the budget in other areas, and so as part of the budget hearing, we'll go through some of that too. And then this shows that we're adding the technology referendum, or the technology part of the referendum, which is $1.4 million. The $2.5 million really isn't an add to our budget because that's just saving programs. So it really doesn't add any money to our budget. But you have to take off the maintenance referendum, and there is some carryover left. We've been keeping track of that 1.3 over the last 5 years, and if there's $336,000 that hasn't been spent, so that's been segregated, so that maintenance can still spend that money. So then if you take the Fund 10 and Fund 27 as our special education fund, you add those two together and you subtract the transfer between the funds, our expenses are going up about 3.14% approximately. And this budget uses fund balance. And there are several reasons for that. That maintenance referendum carryover I just talked about is included in the expenses, but there's no corresponding revenue to go with it. We received a Microsoft settlement that I'm sure that Dave has probably talked about in the technology area, and all of that money has been received, but it hasn't all been spent yet. That's in our expenditure budget. Innovative programs We talked about coming out of fund balance because there were one-time expenses, things like the STEM coordinator. West is starting a global academy, and there's a few other things on that list. And then the transition to the strategic compensation plan, the entire amount isn't coming out of fund balance, but a portion of that cost to transition to that new plan is also coming out of fund balance. So in total, the current budget that is the preliminary budget that's going to be presented at the budget hearing uses $961,000 of fund balance. I'm always really skeptical to show a tax levy impact, but I know that that's part of a workshop on budget is to show at least a preliminary. I would have liked to add a few more adjectives. I know it's a conservative preliminary tax levy. I just wanted to really highlight that this is really preliminary. And the purpose of showing this, and the next slide will show a less optimistic tax levy. This is like the most optimistic tax levy, but we told the public that this referendum would cost 56 cents above and beyond what our normal increase would be for next year. So if you just take this budget without looking at the additional energy exemption projects, without looking at maybe what state aid is going to do at the state, we're looking at a 59-cent tax levy increase. So it's really showing that this referendum is doing the 56 cents that we told the public it would. Now this estimate, I tried to project if you as a board do decide to go ahead with another series of energy efficiency projects, which will be presented to the board at the August 27th board meeting. What that does is we're looking at $8 to $10 million worth of projects that goes right on the tax levy. If you choose to go forward with that, you borrow for that. You've been through this before, but that will impact your levy for 14-15. So it could be another, instead of 59 cents, it could be 76 cents. But that's still conservative. I don't have what state aid is going to be. I don't have what equalized values are going to be. And then just my caution slide. These are still estimates. We are very decentralized in a budget, which is really good. Buildings do their own budgets, departments do their own budgets, and so my office pulls all of that together. And so then we haven't really had a chance yet to go over that with a fine-tooth comb to make sure that nothing was missed or make sure that things aren't double in there. So we're still doing that part yet. We haven't taken out like retirements and put in the new hires, so all of that needs to be done yet. We also need to see whether we have all vacant positions accounted for. You know, when we do a snapshot of the budget at a certain point, if they're vacant positions, we got to make sure that we have that accounted for in the budget. We won't know the pupil count till the third Friday in September, so that's always hanging out there. We don't know open enrollment, and as you know, we don't know equalized values or equalized aid at this point yet. So all of those are estimates. So it's a true work in progress. Just a calendar. Obviously, tonight's your first draft. At the 27th board meeting, we'll have a resolution to approve a first-class notification. So you will get a sample, or in your packet then for that board meeting, you'll get that notice. The 10th, we'll have the budget hearing. The 24th, you'll actually pass a resolution to adopt the original budget. And the main reason we need to do that at that point is we short-term borrow then the end of September or early October. They won't let us short-term borrow until you as a board have a budget on file. So that's the real main reason for having to pass a budget at that meeting. Then at the 8th, we'll give you any updates that we have at that point. And then the 22nd, hopefully we will be able to approve the tax levy at that meeting. Now the reason I put the 29th as a possible date to approve the tax levy is DPI doesn't have to give us 8 estimates until October 20th. Well, that's Monday and our board meeting is Wednesday. Plus, if you do end up going forward with this energy efficiency projects, we may need that extra time to get all those numbers together. So I just thought we'd just be prepared to maybe do the 29th, but we will shoot for the 22nd. So that is a very brief, quick budget update. Any questions?
McKinstry thing on the 27th, that's just a workshop, correct? On
Correct.
the energy efficiency?
Correct.
So we're not voting on that?
No.
We're going to get some information on it?
Right. We had hoped to give it to facilities and finance first, but we kept having to change the dates of facility and finance due to a number of reasons. So it is coming to the whole board first. But then facility and finance will have a meeting the very next day to maybe go into either more detail or answer some questions that the board had the night before.
Okay, that's good. The only other thing I had a question on was the lakeside expansion. Is that included in here somewhere? Originally, that was going to be used out of, at least the concept, was going to be the sale of Green Meadow and the TIF funding that we received from last year and this coming year.
In future TIF,
Yes.
right. No, I didn't include any of those costs in this budget because I don't really know what part of that will fall in this budget. It doesn't affect tax levy by any means, so that whole October date doesn't really matter. We may end up having to do a budget revision in the spring to incorporate some of those costs.
Okay. Questions? Anybody have questions?
And I think for clarification, we should indicate that if the energy retrofit levy is approved, a portion of that would affect tax levy because it would affect Lakeside's need for boiler replacement. But other than that, that would be the only impact on a tax levy, would be the otherwise scheduled boiler replacements that need to occur at Lakeside Elementary School. So.
Thank you, sir. All right, looks like the next thing we have is individually considered resolutions. Currently, the way that our policy in regards to our meetings, we cannot do this as a consent agenda. Each one of these 16 items will have to be read individually. So, we begin. Resolution 1A, be it resolved that the Oshkosh Area School District Board of Education approve the appointments, resignations, retirements, and salary schedules as filed with the Board of the Secretary of the Board of Education.
So moved.
Second.
Is there any discussion on the 1A?
I just had a comment. I don't know if it's a comment or an observation or just an encouraging comment or thought. I don't know how I don't know if there's an answer or even a problem. But I think there's, and maybe it deals with communication, maybe it just deals with individuals in general. But it seems that when new positions are hired and the salaries are posted, it creates a rumble out in the district when people that have had compressed salaries for years look at new people coming in their department making anywhere from $5,000, $6,000, $7,000, $8,000, $9,000 more than they are. It happens in my own life. I'm sure it happens in everybody's life. But I don't know if there's a way to be more sensitive to it, empathetic to it, or increase communication in some sort of way. I'm not asking for an answer. I just wanted to make a comment. There's just to be sensitive, be empathetic, and realize that there's a lot of people out there that have been compressed for a number of years. And just what that looks like for them and the dynamic that that can create in the departments, in the schools, in the buildings. Just, that's all.
I understand what you're saying. I mean, in my opinion, a lot of this is was an unintended consequence of Act 10. I mean, you have the public's right to know how their tax dollars are being spent, but it has opened up more of a free market, obviously, for specific areas in education. It is. It's unfortunate.
That's all.
Is there any more comments on 1A? If not, if you could call the roll, please.
Segnac?
Aye.
Segnac, aye. Wiedenhoff? Dito?
Aye.
Dito, aye. Eliason?
Aye.
Eliason, aye. Garner?
Aye.
Garner, aye. Herzog?
Aye.
Herzog, aye. Lumberger?
Aye.
Lumberger, aye. Motion carries.
Resolution 1B.
President, could I ask that we could potentially introduce three of our principals here this evening, and then they don't have to stay through all 16
Oh,
of
I
these
was going to
items?
wait till
on.
announcements, but yes, that would be
They
fine.
can get used to endurance contests later on in their career here. So I'd like to introduce Christine Bergert as the new principal of Roosevelt Elementary School. And then Rhonda Buchanan as principal of Jefferson Elementary School.
Hi.
And Jackie Kiffmeyer as principal of Reed Elementary School. We're on an active campaign here to try to stabilize principal enrollment. The nice thing is that as applicants and presently all our residents in the community, and that should help us with stabilizing enrollment. But welcome to all three of you. Thank you.
Resolution 1B, be it resolved, the Oshkosh Area School District Board of Education approve the appointments and salary schedule as filed with the Secretary of the Board of Education.
So moved.
Second.
Any discussion? Hearing none, please call the roll.
Wiedenhoff. Vito.
Aye.
Vito, aye. Eliason.
Aye.
Eliason, aye. Garner.
Aye.
Garner, aye. Herzog.
Aye.
Herzog, aye. Limburger.
Aye.
Limburger, aye. Saginaw.
Aye.
Saginaw, aye. Motion carried.
Resolution 1C, be it resolved, the Oshkosh Area School District Board of Education approve waiving the 45-day requirement resignation notice requirement set forth in OASD Rule 223.1, Administration, Compensation, and Benefits for Krista Huntley Rogers, as filed with the Secretary of the Board of Education in accordance with the rules, regulations, and policies of the Board of Education.
So moved.
Second.
Is there any discussion? Hearing none, please call the roll.
Vito.
Aye.
Vito, aye. Eliason.
Aye.
Eliason, aye. Garner.
Aye.
Garner, aye. Herzog.
Aye.
Herzog, aye. Limburger.
Aye.
Limburger, aye. Saginaw.
Aye.
Saginaw, aye. Wiedenhoff. Motion carried.
Resolution 1D, be it resolved that the Oshkosh Area School District Board of Education approve the resignation as filed with the Secretary of the Board of Education in accordance with the rules, regulations, and policies of the Board of Education.
So moved.
Second.
Any discussion? Please call the roll.
Eliason.
Aye.
Eliason, aye. Garner.
Aye.
Garner, aye. Herzog.
Aye.
Herzog, aye. Limburger.
Aye.
Limburger, aye. Saginaw.
Aye.
Saginaw, aye. Wiedenhoff. Vito.
Aye.
Vito, aye. Motion carried.
Resolution 1E, be it resolved that the Oshkosh Area School District Board of Education approve waiving the 45-day retirement resignation notice requirement as set forth in Oshkosh Area School District Rule 223.1, Administration, Compensation, and Benefits for Chris Rogers, as filed with the Secretary of the Board of Education in accordance with the rules, regulations, and policies of the Board of Education.
So moved.
Second.
Is there any discussion? Hearing none, please call the roll.
Garner.
Aye.
Garner, aye. Herzog.
Aye.
Herzog, aye. Limburger.
Aye.
Limburger, aye. Saginaw.
Aye.
Saginaw, aye. Wiedenhoff. Vito.
Aye.
Vito, aye. Eliason.
Aye.
Eliason, aye. Motion carried.
Resolution 1F, be it resolved, the Oshkosh Area School District Board of Education approves resignation as filed with the Secretary of the Board of Education in accordance with the rules, regulations, and policies of the Board of Education.
So moved.
Second.
Is there any discussion? Hearing none, if you would please call the roll.
Herzog.
Aye.
Herzog, aye. Limburger.
Aye.
Limburger, aye. Saginaw.
Aye.
Saginaw, aye. Wiedenhoff. Vito.
Aye.
Vito, aye. Eliason.
Aye.
Eliason, aye. Garner.
Aye.
Garner, aye. Motion carried.
Resolution number 2. Be it resolved that the Oshkosh Area School District Board of Education approve the strategic compensation guide and salary matrix as filed with the Secretary to the Board of Education.
So moved.
Second.
Discussion. Yes.
Again, I appreciate all the work that has gone into this. I just want to make sure that as we go through this, because this is really uncharted waters, that we continue to make sure that all the parties who are most impacted by these decisions are included at the table. We do have a strategic goal through Oshkosh for Education. First goal is to show respect to teachers, and it's very important that the teachers be at the table. And as we go through this process, I'm sure there will be needs to tweak parts of this as we go through. And I just want to make sure that we include teachers in that process.
Dr. Sagan.
I echo that, Barb. Same thing. there's sometimes a sense that they're not at the table, and that's been made clear this past week, that decisions are being made, and maybe that's just a communication issue, I'm not sure. But again, I think people need to be aware, because there's a sense of surprise out there right now that nobody really knows what's going on. And I've been assuring them that it will all be okay. But a couple of points that I would just like us to consider is to really be sensitive to increasing any additional paperwork duties or other duties, because that's really been troubling out there in this time of assessment and evaluation. It seems like we often end up doing more documenting of what we're doing than teaching or what we're supposed to be doing. So I'm just asking for there to be sensitivity. That's all there is. So two things: being sensitive to documenting all of that is really creating some rumbles out there, and also the number of points that they're being asked to document is creating some troubling feelings. That's all. I'm not asking for an answer. I just want us to be very, very sensitive to that.
And we've been fortunate that we do have a data developer, Craig Shalibi, has come aboard, and he has streamlined the process, so it's very easy. It's a Google form that they can fill out, and it's just a one-step process, and then hands are off. So we think that is a really clean process for people, and I think they'll find that it's pretty fast.
And once their points are approved, it will populate in a tab in their Infinite Campus piece, in their instruction piece, that they have daily contact. And all they have to do is click on that tab, and they'll see exactly what's been approved and where the points are. And being cognizant of that paperwork, the third step, as far as there was a reflection piece, we actually removed that out of there, and that piece is not in there. And we heard from your feedback that the last thing we want to do is make this burdensome on our teachers, and that has been the theme over and over again, that we really want everything pulling in the same direction. We want streamlined processes. This should not be burdensome or additional paperwork. So we have been very cognizant of that.
So then maybe just probably, and I know you'll do this, trying to make sure that that's communicated very, and I know communication is always the number one challenge with an entity this large.
Correct.
We have a communication all set to go after if it's approved tonight. And I'll tell you what, I'll CC the board into it so you see that communication. Regarding the points, 35 points, we have prorated that for 14, 15 based on the fact that we're getting started tomorrow on August 14th, given everything goes tonight. So we prorated that. Following, the committee talked about the points, the district points, on a number of occasions, and we fell on 35 based on basically a 36 or 37 weeks of work in a school year, being 1 hour of professional learning per week is basically kind of how we rationalized that number. But also within that number of 35 district points, there are 10 points that an educator can use that he or she may attend a PTO meeting, something that benefits the district, the school, or the students that's outside of the workday. So they can accumulate 10 points for that of the 35. And we're going to be meeting with the teachers on, I think it's August 28th. Is that the date? Thursday morning. And that's all in this communication too. So we're setting up all that communication. So it is very important that we do a thorough job with communication. And it's coming.
So I can tell.
And I believe you've put together a anticipated set of frequently asked question set that will be part of that distribution as well, so that there's a great deal of clarification regarding that issue.
Correct. And we have the link to the form, so they'll be able to see that immediately as well.
I mean, I remember we've had this discussion about the points earlier, and the committee did have some feedback from teachers on it, right? Yeah. So, and I would assume that you haven't chiseled that number into stone anywhere.
And that's the good point, John, is because we're going to be reviewing the plan on an annual basis, and if the 35 is too much, too little, we can tweak that.
Right.
I think that's the real key is really we need to go into this seeing that we need to be flexible on this. This cannot be written in stone, even though it's written on paper. We need to have flexibility in this first year, seeing if this is actually going to work.
And to just always be sensitive to, we keep doing more with less. And that affects wellness. I think a lot of this, we can have the greatest clinic in the world, but there's a lot of stress that goes on that a clinic won't, lifestyle coaching won't help, but that maybe from where we are, we can help.
And I guess I was the one who got this conversation started.
Oh, no, I would have started it.
But I'm glad you chimed in. But I just think it's critical that the teachers are at the table and that when we continue to use an approach that this district has used for probably the last 20-plus years, a quality improvement model where you've planned this, now you're going to implement it or do it, and then you have to check to see how it's working, and then you make revisions. I just want to make sure that teachers are part of that process. I think that's going to be critical for us as a district to address that first strategic goal. And so I just see this as tied together, and so I just want to make sure that as this is tweaked as we go forward, that the teachers are at the table and have their voices heard. That's really what I'm asking.
And if you recall from several of our workshops, we had talked about the composition of our team that worked on this. There was 23 members, and 15 members of that team are professional educators that are impacted by this model, and so their voices were crucial. In addition, the OEA has been a great partner through this, giving us feedback and helping us generate the frequently asked questions and asking clarifying questions and helping us with revisions as we're going through this. And have you thought about this? Have you thought about that? And their input has been very valuable as we've been going through this process.
The other comment I wanted to make is that all teaching positions are not equal, and I know that we have approved a variety of appointments over the summer, and sometimes I guess I have to look at those twice, where we have, for example, a traveling teacher, whether that's art, music, or physical education, who is assigned to 2 or 3, or in some cases 4 buildings. That's a very different assignment than perhaps a person in one of those specialty areas who has 1 building. Similarly, I believe all the board heard today from an individual at the high school level who was given a new a new area to teach an upper level course, and is also traveling to 2 buildings. To meet the needs of the students in those upper level courses is a challenge in and of itself, and then when you're traveling to 2 buildings and preparing for that entire curriculum for the year is quite a challenge. I'm not trying to diminish in any way any teaching assignment in the district. I'm just saying that they are not all equal given the travel demands and the nature of the content of some of those courses. So the 36 points may look very different to someone who's in 1 building all day long, 5 days a week, as compared to somebody who's traveling to 3 and 4 buildings during the course of the week.
It can feel overwhelming to just suddenly think, okay, I have to add that to my plate too. And that's the sensitivity part.
One of the things that we really want to be clear about is it doesn't have to be a workshop or a conference. It doesn't have to be this thing that we are attending. It's what we do each and every day. So if I'm getting together with, my colleagues and we are doing a collaboration and maybe perhaps looking at our common assessment or looking at student work, that is perfectly fine. And honestly, that's what we want, is we want it to be about student work.
Absolutely.
So it shouldn't be about creating this grand thing. And I think people are nervous, though, because I don't know if that has always been.
I think it's the extra step more so than what it is. I think it's the number of points, and it's okay. Now I have another extra step where I have to fill out a document form. It's that extra step that can feel overwhelming. Something else I have to do. I don't have an answer. I just am asking that we're sensitive to that. That's all.
I think we're going into such a radically new education environment that I mean, honestly, I don't think anybody knows if 35 points is reasonable, unreasonable, a lot, a little. And I'm hoping that we built up enough of a trust relationship with our people that they shouldn't be nervous if this doesn't look good. I think we demonstrated that we're responsive to things, and I just everybody remain. The phrase I like: remain calm, carry on, and if we need to tweak it, we'll tweak it.
I have reminded individuals repeatedly that the issue that the sophisticated terms and conditions that were demolished by Act 10 in 2011 was not that same level of sophistication in 1973 or whenever the first one was written. It matured over time and developed over time with adjustments and inoculations and enhancements and subtractions. And in this model of starting from scratch, we are really in its first time run through, of which I would anticipate in 1 year, 2 years, 3 years, that there will be modifications just like there were in a collectively bargained agreement.
For myself, I have two things. The first thing is I support this. There's good things, bad things in here. I like the focus on professional development. I like the fact that we raised up, eliminated the first 2 tiers or whatever it was to make us more competitive, because that is one of the things that all of us as board members see is resignations. There's the churn and burn that we've been having these last few years since Act 10, because the entire environment is so liquid. So there are some good things within this document, and I will be voting in favor of it. That being said, I received a phone call, in-depth phone call from President Wiedenhoff, and he asked me to convey to the board that if he was here, he would be voting against this. And the reason that he would be voting against this is that he does not see this being that different than what our previous compensation model was. There's some tweaks and things in here, but Matt was hoping for a much more progressive, out-of-the-box type of approach to this. He does not understand about evaluations and other things, but he wanted me to convey that, and I told him that I would do that, so he would not be voting in favor of this if he was here. Is there any more discussion on this?
I would, Mr. Deal. I've been close to this for some time, and it's been, to put it into terms, a white-knuckle ride, right? Because from inception, with the hiring of the firm, the consultancy, through the meetings we've had along the way, I've been very respectful and been sort of, proud of that work, glad to be part of that. There's a really good work coming out of that. Okay, and I think the end product that identifies professional development as a keystone of where we go as a district and with our professionals is good and important. In fact, I think it was Dr. Herzog maybe who said that one, I'll paraphrase, but one really an essential part of this profession is professional development, and I agree with that. And in my professional life, it's had an immeasurable impact. So I come from an orientation that says, yeah, this is really important. The quandary that I have is that I try to square that work with those individuals I run across, both in this world and in the outside world, who are, for lack of a better term, sort of hair-on-fire people, right? That impossible to quantify characteristic of relentless, tireless passion, creative thinking, bringing people along. And I so much wish that was part of this. So if I could wave a wand, I'd say, let's adopt this, because it's a good starting point. I think it really addresses professional development well. And let's sunset it at a year or 2 or 3 years, and then let's add on that component of what we'll call the hair-on-fire component. And so then we can kind of ferret out what that term really means and how we measure that. But that would be my dream scenario. So, like I said, the people at the table were fantastic. The consultancy was really good. But there's also Kohler Company and 3M and Trek Bicycle and all these other, and Marshfield Clinic and all sorts of other professional practices that have a lot that we could gain from it. I think they weren't adequately represented in this process. And we, when we narrow the door to entry, we lose something. I think that's, maybe we swung for a double here, we could have swung for a home run. Is sort of how I'd characterize it. So.
Well said, Mr. Lewis.
Thank you.
Any more discussion? Hearing none, call the roll, please.
Hamburger?
Aye.
Hamburger, aye. Saginaw? Aye. Saginaw, aye. Wiedenhoff? Beal?
Aye.
Beal, aye.
No.
Eliason, no. Garner?
Aye.
Garner, aye. Herzog?
Aye.
Herzog, aye. Motion carried.
Resolution number 3. Be it resolved, the Oshkosh Area School District Board of Education approve the employee handbook, employee benefits and summary, and the appendices for the 2014-15 school year as filed with the Secretary of the Board of Education.
So moved.
Second.
Any discussion? Hearing none, call the roll, please.
Saginaw?
Aye.
Saginaw, aye. Wiedenhoff? Tito?
Aye.
Tito, aye. Eliason?
Aye.
Eliason, aye. Garner?
Aye.
Garner, aye. Herzog?
Aye.
Herzog, aye. Lumberger?
Aye.
Lumberger, aye. Motion carried.
Resolution number 4, be it resolved that the Oshkosh Area School District Board of Education approve a base wage increase of 1.46 for all NTEA employees as filed with the Secretary to the Board of Education.
So moved.
Second.
Any discussion? Hearing none, call the roll, please.
Wiedenhoff? Tito?
Aye.
Tito, aye. Eliason?
Aye.
Eliason, aye. Garner?
Aye.
Garner, aye. Herzog?
Aye.
Herzog, aye. Lumberger?
Aye.
Lumberger, aye. Saginaw?
Aye.
Saginaw, aye. Motion carried.
Resolution number 5, be it resolved that the Oshkosh Area School District Board of Education approve a 1.46% increase in total base wage for the professional teaching staff for the 2014-15 school year as filed with the Secretary to the Board of Education.
So moved.
Second.
Is there any discussion? Hearing none, please call the roll.
Tito?
Aye.
Tito, aye. Eliason?
Aye.
Eliason, aye. Garner?
Aye.
Garner, aye. Herzog?
Aye.
Herzog, aye. Lumberger?
Aye.
Lumberger, aye. Saginaw?
Aye.
Saginaw, aye. Wiedenhoff? Motion carried.
Resolution 6, be it resolved, the Oshkosh Area School District Board of Education approve a base wage increase of 1.46% for all paraprofessional employees, OPEA, as filed with the Secretary to the Board of Education.
So moved.
Second.
Any discussion? Hearing none, please call the roll.
Eliason?
Aye.
Eliason, aye. Garner?
Aye.
Garner, aye. Herzog?
Aye.
Herzog, aye. Lumberger?
Aye.
Lumberger, aye. Saginaw?
Aye.
Saginaw, aye. Wiedenhoff? Tito?
Aye.
Tito, aye. Motion carried.
Resolution 7, be it resolved, the Oshkosh Area School District Board of Education approve one-step and longevity movement for the eligible clerical maintenance and custodial employees as filed with the Secretary to the Board of Education.
So moved.
Second.
Any discussion? Hearing none, if you could call the roll, please.
Garner?
Aye.
Garner, aye. Herzog?
Aye.
Herzog, aye. Lumberger?
Aye.
Lumberger, aye. Saginaw?
Aye.
Saginaw, aye. Wiedenhoff? Tito?
Aye.
Tito, aye. Eliason?
Aye.
Eliason, aye. Motion carried.
Resolution number 8, be it resolved, the Oshkosh Area School District Board of Education approve longevity movement for eligible paraprofessionals as filed with the Secretary to the Board of Education.
So moved.
Second.
Is there any discussion? Hearing none, if you could call the roll, please.
Herzog?
Aye.
Herzog, aye. Lumberger?
Aye.
Lumberger, aye. Saginaw?
Aye.
Saginaw, aye. Wiedenhoff? Tito?
Aye.
Tito, aye. Eliason?
Aye.
Eliason, aye. Garner?
Aye.
Garner, aye. Motion carried.
Resolution number 9, be it resolved that the Oshkosh Area School District Board of Education approve a 1.46% increase in base wage for all food service employees as well as one-step and longevity movement for eligible food service employees as filed with the Secretary to the Board of Education.
So moved.
Second.
Is there any discussion? Hearing none, please call the roll.
Lumberger?
Aye.
Lumberger, aye. Saginaw?
Aye.
Saginaw, aye. Wiedenhoff? Tito?
Aye.
Tito, aye. Eliason?
Aye.
Eliason, aye. Garner?
Aye.
Garner, aye. Herzog?
Aye.
Herzog, aye. Motion carried.
Resolution 10, be it resolved that the Oshkosh Area School District Board of Education approve a 1.46% increase in base wages for the International Association of Theatrical Stagehand Employees as filed with the Secretary to the Board of Education.
So moved.
Second.
I will be abstaining on this, as this is the group that I represent.
Can I, is this discussion?
Yes.
It says $398. What are we talking about here?
What is that?
It's $398 is the net budget impact. What are we talking about? What is $398? Are we talking about a person or
No, it's total
total budget for the year?
increase.
Oh, increase. So that's just the 1.46%. Okay, good enough.
Any more discussion? Call the roll, please.
Saginaw?
Aye.
Saginaw, Guy Weekenhoff? Vito?
Abstain.
Vito abstain, Eliason?
Aye.
Eliason, aye, Garner?
Aye.
Garner, aye, Herzog?
Aye.
Herzog, aye, Lumberger?
Aye.
Lumberger, aye, motion carried.
Resolution 11, being resolved that the Oshkosh Area School District Board of Education approve the changes to policy 453.5, student accident illness, as filed with the Secretary to the Board of Education.
So moved.
Second.
Is there any discussion on this one? Hearing none, please call the roll.
Weekenhoff? Vito?
Aye.
Vito, aye, Eliason?
Aye.
Eliason, aye, Garner?
Aye.
Garner, aye, Herzog?
Aye.
Herzog, aye, Lumberger?
Aye.
Lumberger, aye, Saginaw?
Aye.
Saginaw, aye, motion carried.
Resolution number 12, be it resolved that the Oshkosh Area School District Board of Education approve the changes to policy 4113, section 504, plan non-discrimination on the basis of disability, as filed with the Secretary to the Board of Education.
So moved.
Second.
Is there any discussion? Hearing none, please call the roll.
Vito?
Aye.
Vito, aye, Eliason?
Aye.
Eliason, aye, Garner?
Aye.
Garner, aye, Herzog?
Aye.
Herzog, aye, Lumberger?
Aye.
Lumberger, aye, Saginaw?
Aye.
Saginaw, aye, Weekenhoff? Motion carried.
Resolution 13, be it resolved, the Oshkosh Area School District Board of Education approve the changes to policy 538, professional staff evaluation, as filed with the Secretary to the Board of Education.
So moved.
Second.
Is there any discussion? Hearing none, please call the roll.
Eliason?
Aye.
Eliason, aye, Garner?
Aye.
Garner, aye, Herzog?
Aye.
Herzog, aye, Lumberger?
Aye.
Lumberger, aye, Saginaw?
Aye.
Saginaw, aye, Weekenhoff? Vito?
Aye.
Vito, aye, motion carried.
Resolution 14, be it resolved, the Oshkosh Area School District Board of Education approves salaries for administration compensation of the 2014-15 contract year effective July 1, 2014, as filed with the Secretary to the Board of Education.
So moved.
Second.
Discussion.
I just want to say I appreciate the role of administration in addressing some of the questions that I raised at the last board meeting.
Any other discussion? Hearing none, please call the roll.
Garner?
Aye.
Garner, aye, Herzog?
Aye.
Herzog, aye, Lumberger?
Aye.
Lumberger, aye, Saginaw?
Aye.
Saginaw, aye, Weekenhoff? Vito?
Aye.
Vito, aye, Eliason?
Aye.
Eliason, aye, motion carried.
Resolution 15, be it resolved that the Oshkosh Area School District Board of Education approve early childhood contract for the 2014-15 with UW Oshkosh Lincoln School, as filed with the Secretary to the Board of Education.
So moved.
Second.
Is there any discussion? Hearing none, please call the roll.
Herzog?
Aye.
Herzog, aye, Lumberger?
Aye.
Lumberger, aye, Saginaw?
Aye.
Saginaw, aye, Weekenhoff? Vito?
Aye.
Vito, aye, Eliason?
Aye.
Eliason, aye, Garner?
Aye.
Garner, aye, motion carried.
Resolution 16. I have an option to have a request that waiving of this so that we don't have to read the entire thing, but you know what, I think I'm going to read it. Resolution 16 deals with something we have not done yet, which is with our expulsion process to hire an independent hearing officer to deal with our expulsion process. So I think I will go through this. Whereas pursuant to section 120.13 1E of the Wisconsin statutes, the school board may adopt a resolution authorizing an independent hearing officer appointed by the school board to determine pupil expulsion from the school under sections 120.13 1E2 through 120.13 1E4, and whereas such a resolution authorizing the use of an independent hearing officer to determine pupil expulsion is effective only during the school year in which it is adopted. And whereas the school board of the Oshkosh Area School District desires to authorize the use of an independent hearing officer to determine pupil expulsion for the 2014-15 school year, therefore be it resolved that the school board of the Oshkosh Area School District that pursuant to Section 120.13.1E of the Wisconsin statutes, the school board authorizes an independent hearing officer appointed by the school board to determine pupil expulsion matters for the 2014-15 school year, and be it further resolved that the Oshkosh Area School Board shall by motion appoint one or more individuals who, in judgment of the school board, are qualified to serve in the capacity of an independent hearing officer under Section 120.13.1E of the Wisconsin statutes, and thereafter the district administrator or any administrative designee of the district administrator may select an individual who has been so appointed to hear and determine, subject to the school board's review of any expulsion order, any pupil expulsion matter that arises in the school year in which this resolution is effective. And be it further resolved that the officers, employees, and agents of the Oshkosh Area School District are authorized and directed, to the extent consistent with the applicable law and school board policy, to do any and all things reasonably necessary to accomplish the purposes of this resolution. Well, this resolution was adopted by the school board and is recorded in the minutes of a school board meeting held on the 13th day of August 2014.
So moved.
Second.
I'd like to say that in the years that we have, well, I would speak for myself, that I've been on this board, one of the most painful parts of being a school board member is dealing with the expulsion process. It is heartbreaking sometimes to deal with on a number of different levels. It's also extremely difficult to coordinate people's schedules to get together because under state law we have to have a quorum of board members to hear this, and it makes it exceedingly difficult to do this throughout the school year with everybody's schedules and regular jobs that they deal with. One of the things that I did like about this when this was first brought forward is that this is only for this year. Once again, trying something progressive, something different. If it doesn't work, well, then we won't do it next year. But if it does work, maybe we'll consider doing it again next year. So I guess I'm in favor of it. Is there any other discussion?
I just have a question. In the long paragraph, one of the first one that begins, be it further resolved, it goes on to say that the board shall, by motion, appoint one or more individuals who are qualified to serve in the capacity of an independent hearing officer. Does that mean that there will be a list coming to the board at some point for the board to approve, and from that point forward, then administration picks someone from that list? Is that how this process will work?
No, Barb, it would authorize the superintendent to appoint those individuals. We do have a person who serves in this capacity, is a practicing lawyer, and has done this with other school districts as well for several years. But this resolution per se authorizes the superintendent to make these appointments. So that's how this would work.
I'm really confused then, because it says that the school board shall by motion appoint one or more. It doesn't say that the superintendent shall appoint. It goes on to say the district administrator or designee of the district administrator may select an individual who has been so appointed. So this seems to be in conflict, or at least I'm confused by what you just said in terms of what
I guess I was
reading here.
referring to the latter part, Barb, that I think by adopting this resolution, we would be more than happy to, not a problem, I'd be more than happy to supply the names of individuals. That's not a problem. Be glad to do that.
Well, I just think it's important to follow our policies and procedures, and if I'm reading this wrong, then correct me, but if, from what I'm reading, it looks like the school board would be the one, or the group to appoint folks to serve in this capacity, and then the district administrator or designee selects people from that list. That's what I thought we were doing, but maybe I'm
I agree, if I understand English. And there's people that might argue that, but I think I do. It sounds like we approve a list, and then the administrator can pick off the list.
We can bring back at the second board meeting of this month, before we have a single student in the district.
Yeah, we want to that was the goal, is to get this before school started.
Right. So But we can effectuate the list that has been used by other districts, and then we can select from that. The other issue that I think we should carefully point out, that this does not take away from final action on
Correct.
On a expulsion. It comes back to the board with a recommendation from that hearing officer. So the board is not absolved from final voting on the case in every case. The board retains that responsibility.
And just to clarify, Mr. Dito, that this will be an annual motion that will come, a resolution that will come before you. The board at any time may elect not to do this, and it also does not give the board does not give its right to hear a case if it so chooses. This just authorizes that you may, if you want to have somebody else to hear the case for you, and then present that judgment to the board, which you would make the final decision. You always will make the decision.
Is that part of Wisconsin Statute 120.13.1E? I mean, is that incorporated in there that you have to do it on an annual basis?
Yes, this has to be approved annually.
In a way, that's a good idea, because school boards are transient.
Mhm.
I mean, elections every April and such. So that's probably a good idea to review this on an annual basis.
And again, just for review, the board has already approved the policy, and this is the action that's associated with the policy that's already been approved.
And ideally, we wouldn't have to implement this at all.
Yes.
Ideally, I hope we don't have to use it at all this year. That would be a great year. I agree.
Depends upon how successful those pre-expulsion hearings are.
Yes, they've been very successful.
Anyway, is there any more discussion on it? Please call the roll.
Aye.
Aye. Megan, aye. Wiedenhoff. Vito.
Aye.
Vito, aye. Eliason.
Aye.
Eliason, aye. Garner.
Aye.
Garner, aye. Herzl.
Aye.
Herzl, aye. Motion carries.
Request for future agenda items. Hearing none. Announcements. I will say this, that after going through a total of 21 resolutions and reading each one, that we are going to be in policy and government, taking a look at that policy, which requires us to do this. The idea of a consent resolution is efficiency. And if somebody has, certainly we would oppose the strategic compensation model and some other things out of there to discuss, because, well, we have that right. But to go through all the rest of the tedium, sometimes it's, I don't know. We'll take a look at it. Maybe we can just put a may in there or something.
Instead of a
Doesn't
shall?
make that you have to or something. Anyway, announcements done. Anybody else have announcements? This time, motion to be entertained to adjourn.
So moved.
Second.
Call the roll, please.
Saginaw.
Aye.
Saginaw, aye. Wiedenhoff. Vito.
Aye.
Vito, aye. Eliason.
Aye.
Eliason, aye. Garner.
Aye.
Garner, aye. Herzl.
Aye.
Herzl, aye. Lumberger.
Aye.